Welcome back. In today's Art of Dentistry, Dr. Robin Rutherford and two members of his staff, Dana Eubanks and Beth Smith, join us to talk about DNA saliva testing. We have a group of y'all today, and I'm so excited to have y'all.
Yeah, this is two of the ladies that work with me and have been working with me for a long time. This is Beth Smith, and she is one of my hygienists.
Okay.
And this is Dana Eubanks, and she also is the other hygienist. We have two. They have worked with me for a long time. I kid Beth because she goes back to before the turn of the century. She's worked with me for 21 years, I believe it is.
A long time.
And
Wow.
12 for you, Dana, right?
Yes.
So they've worked together for 12 years.
Awesome.
But they are the two best hygienists that I have ever worked with in my whole career. And I'm very blessed to have them. In fact, I just kind of leave a lot of what they do to them because they're excellent. And so we just wanted you to meet them as well.
Yeah, well, we're so excited to have you all.
Thank you.
Beth, I want to talk to you first. I know in Dr. Rutherford's office, he gives y'all the opportunity to go and do a bunch of, continuing education, which is great. Will you tell us a little bit about that?
Sure. Dr. Rutherford, as long as I've been with him, has been very pro-education. It's been very important to him to have the whole, not just Dana and I, but the whole entire staff. He will send to a conference every year without fail. And he's always wants us to be state of the art, cutting edge, and he has a vision. And I'll give you an example. One year he sent us, Dana and I, to Kansas, and this was before.
Yeah, we all three went together, in fact.
Yes.
This was before that hygienists were even allowed to use lasers, and he sent us to Kansas to learn about the lasers and the techniques. And then when the legislation passed, very shortly after that, we were ready to go. So I appreciate his vision and
So you guys have been using lasers as part of your periodontal treatment for
absolutely.
how long?
It's been very instrumental. How long, Dana?
About
At least
nine
Yes.
years.
Yeah.
Wow.
After 20 years, it's okay.
So y'all know what y'all are doing, basically.
Yes.
We better.
Absolutely.
Well, Dana, tell us a little bit about DNA saliva testing.
Okay.
I'm really intrigued to learn what this is.
Yes, so with periodontal disease, some people know it as gum disease. You're dealing with basically a bacterial infection, and it's just like any other infection that you get when you're sick. The problem with this type of infection is not everybody knows that they have it. So when they come in to see us, we do a lot of steps to take measurements and take a really good, thorough evaluation, because every patient is different. Not everybody is the same, and we don't do treatment the same on every single treatment.
Okay.
It's all customized. So where we have our laser that treats bacteria, we also have a simple test that we can do that's called saliva DNA testing. And we'll take a small sample of saliva, send it to the lab, and they'll test the bacteria. And there are specific bacteria that are actually very aggressive pathogens. They're contagious. You can spread them back and forth, person to person, and they destroy the jawbone and the tissue around the teeth. And so then that's why you'll see people, as they get older, they lose their teeth and end up with dentures. So when we know exactly which bacteria the patient has, then we can specifically target that bacteria with the medication that they need. So we're killing it physically with the laser, but we're also killing it systemically, so the results are better. They can stay maintained and stable, and then we'll put them on a really good schedule for maintenance.
Wow. And how important is this testing for you all? I mean, it seems like you can definitely treat the patient better with this.
Yes, you can. And we don't do a saliva test on every single patient. It kind of just depends on the criteria there. But if you've treated a patient, you've done everything that you know to do, they've done everything they know to do, and something's still not responding or something's still staying infected, then we go in to do a saliva test, and we can uncover something a little bit deeper and treat that systemically, and we've had great results. We've been using saliva testing almost as long as we've been using our lasers, for 9 years. So it's been great. It's really...
So that's another thing that we learned at a seminar too.
Yes.
You don't just come up with this stuff out of the air. You learn what is out there, what people are coming up with, and trying to stay, at the forefront of our profession.
Yeah, and Dr. Rutherford, how often do you see patients with gum disease?
Almost everybody.
Yes.
It's really surprising. You would think that most people would be fine and the occasional person would have a problem. If I saw 20 adult new patients, I bet you 2 of them would need a simple routine little cleaning, and because they're fine. preventive type cleaning. I bet the other 18 would have some gum disease going on. Gingivitis is the first stage, and then beyond that, you know, it gets more and more where you eventually lose bone from around the roots of your teeth, and that's what gum disease does. The infection eats the bone away, and so that's what we want to prevent. And someday we're working on maybe making the bone grow back, but we can't do it yet.
Yeah, so it's not something that you should be embarrassed of, but definitely important to get fixed.
Yeah.
Okay. Well, thank you all so much for being with us today.
Thank you.
Appreciate you having us.
Thank you.